I I had gotten into two engineering programs and Rutgers Pharmacy, and I got to be honest, I didn't know what I wanted to do with an engineering program. It was completely undecided, whereas pharmacy had a very set curriculum, and I knew I wanted to do something with the sciences, so I committed fully into pharmacy. I know there's a lot of emphasis about finding your dream job, but I think what's important is to find passion in what's available to you and learning to be content with that.
Hello and welcome to the Patient to Professional podcast. My name is Dr. Nick Despotidis, and I've had the pleasure of examining thousands of children through the years who are now working adults. Today, with me, I have such esteemed pleasure to introduce Eddie's son. Eddie has been my patient for almost 2 decades. He's a pharmacist. He's here to tell us a little bit about his career. Eddie, thank you so much for joining the podcast.
Dr. D, thank you for having me.
All right. So why don't you're a pharmacist. I think you're in a hospital setting. Would you start by telling the audience what exactly you do and describe your typical day at office or at the pharmacy?
Sure. I am the current director of pharmacy at a community hospital in Southern Ocean Medical Center. Um, my typical day is I've sh kind of shifted away from the clinical side of pharmacy and into regulatory affairs and quality assurance and things of that nature. And so one of my major things to do is to make sure that one, we have all the policies that we need for regulatory coverage in terms of a various number of things, right? Pharmacy in a hospital ranges from obviously medication management for our patients to sterile compounding, and there's a lot of multidisciplinary work in a hospital that also involves pharmacy. So my job is to manage my team so that we can provide the best medication care for our patients.
So it sounds like you're in a managerial role right now, correct?
Yeah, surprisingly, I think
You
that
say
wasn't what I had
surprisingly.
imagined.
I think you've been in a hospital setting since you graduated Rutgers, correct?
Yes, and actually, even before, I had started out as a pharmacy tech back in 2000, 2008, if I remember correctly.
Wow.
Yeah, it's been quite a road.
So, for someone who's interested in pharmacy, what attracted you to this type of clinical setting? I'd like to discuss for the audience the different type of fields pharmacists can get into. What attracted you to this type of clinical setting?
So yeah, like you said, there's a lot of paths within pharmacy. For me, hospital practice is interesting because it shifts a little bit faster. We are dealing with challenges that vary day to day. That's not to say that the other pieces of pharmacy are not interesting, but obviously when you have a community-based pharmacist out in like Walgreens or CVS or a mom and pop shop, their interactions with the patients are over a longer period of time. And there's still challenges there, obviously, but I think hospitals keep things very interesting very quickly. There's a lot of variation in
Well,
my
you
day to
see a
day.
lot of sick people, I'm assuming, correct? You mentioned
Yes.
compounding, which a lot of pharmacies like Walgreens do not do on site, at least under sterile conditions. Um, for someone who's interested in pharmacy, in a hospital setting, are your hours better, your salary better? What kind of, again, attracted you to this? I guess the pace and the nuance of it. Is it the hours compared to, let's say, a person who works in a community center like a CVS? Tell us a little bit about lifestyle choices that you made to stay within a hospital-based setting.
I think the general consensus among the profession, at least in clinical practice, is that hospitals do afford a better quality of life. Um, you know, our hours are a little more akin to a regular, 40-hour work week kind of deal, 5 days a week. Whereas out in community practice, I believe their hours are a little bit longer. They work fewer days a week. Um, and in terms of salary, it's I think it kind of leapfrogs every so often. We play catch up once in a while, and then we exceed that of community pharmacists. But as a whole, the market tends to catch up to the same area.
Are there other fields of pharmacy? We talked a little bit about working retail or community based like Walgreens, CVS. Maybe their salary starts out higher, but the quality of life may not be the same as hospital based. Are there other fields within pharmacy that a student could be exposed to other than just community based and clinical hospital based?
Yeah, absolutely. Actually, my wife and I were both pharmacists. We have a number of friends in the industry field, which in New Jersey is extensive, right? All the drug companies are headquartered here.
Okay.
And so they employ a lot of pharmacists that go into that area. And you know, I think that, to my knowledge, they also have very excellent quality of life, good benefits, good salary, and also very challenging work. Like with hospital pharmacy, there's a lot of variation in what they do depending on what kind of drugs they're working on, and the requirements of different market. You can get into marketing if you wanted to. You can get into clinical research if you wanted to. There's a lot of different things to do.
So industry is like Johnson and Johnson, Bristol Myers Squibb,
Hmm.
those type of, and they could do research within their field. Like you said, they could even do marketing of pharmaceutical products and probably get FDA approval, help get FDA approval for drugs, but not so much face-to-face clinical interaction with patients, I'm assuming.
Not with patients. A lot of pharmacists take the MSL path, and they are medical liaisons, and they interact a lot with physicians in their role, but not so much patients.
What's MSL path?
I I want to say it's something. I don't remember the exact you know the abbreviation, but
Yep.
but they provide drug information to to physicians instead of
I see.
patients.
In other words, at me, there's drug reps that come here, introduce their product to me, try to kind of educate me, for lack of a better term, on their
Yes.
products. That's what you're referring to. That's another
Yes.
avenue that a pharmacist can go into.
Right.
Do you like your day to day? What does your typical day look like? Today obviously you're not working, but tomorrow does it change day to day? My day, for example, is very repetitive. I go in, I see patients. For the most part, it's kind of rinse and repeat for me. Is it the same for you or is it very different?
Um, for me, it's a little different in leadership. There's a lot of different tasks for me to handle, whether it's operational or we do have some leadership things that are required from our administration that I have to tackle. For example, one of the things that is top of mind for every pharmacist is drug diversion, right? So that's something that we have to handle every day. I need to make sure that my staff have the appropriate resources to maintain our patient load. Um, we oversee an outpatient infusion pharmacy for patients who come in and get a lot of cancer therapy. But in terms of the pharmacists that do the day-to-day work in the hospital, it's a little more routine. Um, they spend most of their day verifying orders that physicians get and making interventions if we notice any problems, anything that we can optimize. And the task itself varies depending on your patient's clinical picture, but the I guess the overall flow remains the same.
Got it. So your typical week, right now you're in a managerial role. When you first started out, I'm assuming you were much more in a technical role, filling the prescriptions, compounding the prescriptions. Were you working weekdays, weekends? What does a new graduate expect to work if they want to be in a hospital setting upon graduation, first few years of practice?
Early pharmacists will generally land probably less optimal hours, to be honest with you. I had started in my role as a pharmacist in Southern Ocean working 10:30s to or 10:30 to 7s for quite a few years. Um, and you know, as you work up the chain in the department, you get slightly more favorable hours. I had taken a particular interest to pharmacy operations in a hospital, so I went the supervisor management path instead.
Right.
Um, but yeah, like I work for a larger hospital corporation, so we do 40-hour weeks, um, and 5 days a week. So
So in the beginning, when you worked this 10:30 to 7 shift, did you work weekends sometimes also those hours?
yeah, set weekends. At the time, we were a weekend a month, which is better than most, as I understand. We're now
Right.
every third, but we've also expanded our pharmacy services as well.
And what attracted you to administrative role? It seems like you slowly took a path of doing management.
Um, that's an interesting question. Like I said, I didn't imagine myself in this position when I graduated for sure. Um, but I've had the fortune of working with my boss for a number of years, who has been very receptive to letting me experience new things.
That's great.
Um, and there have always been, well, I guess let me put it this way: there have, to be very honest, there have been uh, more highly trained clinicians that handle the clinical side of pharmacy, and so I kind of naturally fell into the operations side. And I guess I've been a little bit more technically minded in terms of uh, new technology and how they operate, and so it just kind of naturally took that path.
Got it. So you like the responsibility of making sure your pharmacists have the necessary regulations, equipment, stock needed to provide good patient care. I would think
Yes, yeah,
logistically that is a lot of responsibility. It's a lot of organization, correct?
it is. And in a hospital, we work between the radiology department for imaging, the OR for their needs, for operations, and also, like I said, we do outpatient cancer therapy as well. So
Yeah.
we work very closely with all the disciplines in the hospital.
That's that's something that I learned because I think a pharmacist, I think you filling a prescription. That's what I think of antibiotics, maybe compounding an antibiotic, but I didn't realize all the pharmaceuticals involved to just routine procedures like x-rays and MRIs and things like that with contrast, without contrast. I guess you're responsible for all those, including oncology.
Yeah, yeah, it's quite a wide scope, but also in a hospital for cost control purposes, we're limited to a subset of drugs, and so in full disclosure, I don't know everything about every drug out there, um, and there are some community pharmacists that have a much wider array of drugs that they use in terms of outpatient treatment.
Right. And I think you'd be fooling yourself and everyone else if you said, I know everything about every drug, and none of us do.
No, my boss and I have a joke, which is if we're the smartest people walking into a meeting, then we're in trouble.
I think you're being very modest, Eddie. Well, tell us if a student is in college and considering pharmacy, what is the procedure? Where did you go to college? Did you go to a 6-year program? Why don't you give us some of the background needed to become a pharmacist?
Yeah, I went to Rutgers University. They have an excellent pharmacy program and continues to be one of the top in the nation. I did do a 2+4 program. So what that entails is you do 2 years of undergrad. You do not come out with a bachelor's degree, but you immediately get induced into the doctorate program for pharmacy. Um, since my graduation, they've expanded on that a little bit. So I think you can, there's various programs now. You can do a 2+4 plus an MBA, a business administration program, or you can also segue that into a medical degree as well. They work in tandem with Rutgers University Medical School. Um, so there's a couple different paths that wasn't available to me now. But also, there's been a much heavier emphasis on residencies and fellowships post graduation as well. So you're probably looking at least definitely if you want a hospital job, um, the first year of residency is very important, and that'll be another year, post graduation.
So,
For
in other words,
fellowships,
in addition to 6 years, a 1 year residency upon graduation from pharmacy school?
yeah, and that'll give you your wider scope general clinical experience. And if you wanted to specialize, if you wanted to do, infectious disease or cardiology, any one of the specialties, you're probably going to do a PGY2 postgraduate year two.
Even 2 years after graduation, depending on that specialty.
Yeah,
So, how about if I worked in a community setting? I wanted to work at CVS. I'm assuming 6 years and I take my board exam and I'm done. Is that accurate?
yeah, yeah. You know, that's not to say that the people who get PGY experience, post grad experience, cannot get community jobs. Um, but our hiring pattern has shifted, at least in the hospital, has definitely shifted towards residency preferred.
That's interesting. I didn't know that. So, you're looking for people that have done some postgraduate residency, either 1 year or 2 year.
Yeah. And as part of my role as a hiring manager, I right now we still grandfather in, pharmacists that do not have that experience. But as we start getting more and more years into a lot of kids getting residencies, that's definitely where it's going to end up. I'm pretty sure.
So you're a hiring manager, and in addition to managing your current, program, you help interview potential pharmacists within your hospital setting.
Yes. Yeah.
What do you look for in an applicant? Are you looking heavily at their resume, how they interview with you? What do you look for in an applicant? I would think listeners would be very interested hearing from you on the other side. For example, you're hiring. What do you look for? What attributes are you looking for and your team is looking for?
Um, it's an interesting question because I think as a baseline, pharmacists come out of school with a certain you know baseline of knowledge.
That's correct.
Um, so you know it really comes down to how well I think you'll fit in with the team, how you, I guess, as the applicant, as the candidate, um, want to grow in your role. Are you curious? Do you want to take on some extra projects and learn? Because I think that's important. Especially, I mean, I have a very hopefully with the approvals that I'm hoping to get, we have a very quickly growing department, with a lot of new programs in mind, and I'm really looking for some open-minded individuals, uh, that can pivot quickly and learn, and at the same time balance their duties with providing our patients with good medical care.
So when I come in, obviously you're looking at my CV, my grades, my GPA, whether I've passed my boards. Do you look at board scores, how well they did on their board when you're hiring? Is that something that you weigh a lot, or is it more like, okay, you're a licensed pharmacist, you qualify. I may have even done a residency. Do you also include my personality, eye contact, the way I show up for an interview, how I dress, how I appear, grooming, things like that. I'm just curious.
Yeah, it, the first impression is important. Um, I have seen pharmacists with, average GPAs, but are very eager to learn, very eager to work, and they've turned out to be great candidates. I've also met people who ace their way through college, but you know are not prepared to work in a team. So it's not always about the number. The number helps,
Of course.
but it really, I really want our team to have a good dynamic. So it really depends on how well I think you'll fit in with the team.
Okay, that's very important. Thank you. Can you also tell me along your educational path, did you have to take a board exam a few times a year or just one board upon completion of your 6 year?
So we do take the boards. It's called the NAPLEX exam upon the completion of your degree. And there's also a law exam. It's called the jurisprudence exam, MPJE, if I remember correctly. Um, you do not need to retake them, but every 2 years, you're expected to get 30 credits of continuing education.
Okay. So basically, you're taking two board exams to become a licensed pharmacist.
Yes. And if you do want additional certifications beyond that, there are a number available to you as well.
If I wanted to specialize.
Yeah. I think the most common one right now is the pharmacotherapy specialist, the PCPS program. And if you do get that, they require additional credits, on top of what the Board of Pharmacy requires as a minimum.
So when you were in high school, did you want to be a pharmacist? It just must be so hard for students in high school, even as they begin college, to decide to commit to a 6 year program, 2 plus 4, like you said. Tell us a little bit about your thought process, if you could remember back then when you were in high school.
Oh boy, this is an embarrassing topic. Because I had no idea what a pharmacist was when I applied to pharmacy school. Um, like you said, I probably had some of the same misconceptions about what pharmacists did, as what a lot of the people think, which is they're behind the counter, counting pills.
Right.
Uh, but you know, I I had gotten into two engineering programs and Rutgers Pharmacy, and I got to be honest, I didn't know what I wanted to do with an engineering program. It was completely undecided, whereas pharmacy had a very set curriculum, and I knew I wanted to do something with the sciences, so I committed fully into pharmacy. That's probably not a hugely inspiring story, but that's my story at
I
least.
find it inspiring because it's honest. How are you supposed to know at 17, 18 years old that you're definitely sure you want to take this path? I think sometimes you make what you can out of the path you take. In other words, you're taking yourself with you, your personality trait, and you seem very happy, am I correct, in the path you've chosen?
Yeah, you bring up a good point, which is I know there's a lot of emphasis about finding your dream job. But I think what's important is to find passion in what's available to you and learning to be content with that. And of course, you're some people are going to get into an awful job situation. I'm not saying that, you just got to suck it up and deal with it. Um, but you know, for 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 someone who really didn't know what they were going to do, graduating from high school, I really learned to enjoy different aspects of pharmacy, and I do find it really fulfilling.
Right. I think that's a critical point. That's why I started this podcast. To be honest with you, my path was very similar to you. I remember vaguely in high school, my physics teacher telling me I should look at optometry. I had no idea what optometry was. I was just good at physics, and I started college, and I was not as good in physics as I thought I was. And I said, well, maybe I remember my teacher mentioning optometry, but I did find my passion within optometry. I thought it was better one or two. You thought it was pill counting. And I thought optometrist says, is this lens clearer or this number two lens clearer? And I thought that's what optometrists did. And like you, I found tremendous joy and fulfillment within my profession, and it kept evolving. It seems like you too. You became a pharmacist, you were a clinician, and now you're growing into a very managerial, administrative role, and you still seem to challenge yourself that way.
Yeah, and I know managers and leaders are a very small portion of the pharmacist community at large, but pharmacy practice is also evolving. Jersey is in a very interesting position of honestly being a little bit further behind than some of the other states, especially out west in terms of pharmacy practice. But you know, in our recent years, we've expanded into unit-based programs in the hospital where we're directly speaking to patients instead of just being stuck in a pharmacy verifying orders. Um, we're starting to embed some pharmacists into local physician offices as part of medication therapy management. There is a lot of change happening in
I think
pharmacy.
so. As a healthcare provider, I see it. I depend on my pharmacist when I call in prescriptions to help me compound the right amount. Also, pharmacists played, I think, a critical role during COVID with the vaccination. I can't even imagine being a community based pharmacist with all the stress of exposing myself to the virus, helping save communities as a whole. I mean, that was unheard of 20 years ago, I'm assuming. And look how much that has evolved during a crisis situation.
Yeah, and not to toot my own horn here, but we did very successfully vaccinate our community down by Manahawk in New Jersey. I think by the end of that program, we had vaccinated 15,000 people. Um, and boy, it was challenging. The COVID was a huge strain on the healthcare system, but
Huge strain. And
it's
I think pharmacists took a huge burden of that strain right on the front line, as many people were. So you're right, it is evolving, and I see it continually evolving as our healthcare system is evolving. So just to wrap up now, you're how many years out? You're about 10 years out of pharmacy school, give or take?
2013, yeah. 12 years at this point. I
12
graduated in
years.
2013.
Okay. If you were to give your 17-year-old self advice, you're looking back and you say, Eddie, son, let me tell you something. What advice would you give your younger self right now?
This is going to sound very minor, but I really gave this some thought, and my answer is learn how to get organized.
Organized.
Oh my goodness, pharmacists have to be uh, very fastidious record keepers, and I wish I learned how to get organized earlier. I really do. But also as a whole, I really think staying curious and staying open, being open to new experiences is extremely important. Um, you know, I had a professor in a law professor in pharmacy school who on our last day said, uh, "You're as smart as you're ever going to be," and I thought that was an awful comment because you shouldn't be. You
Right.
should grow and continue to learn and be a lifelong learner.
And that's really part of the profession that you really enjoy, it sounds like. You're continually growing, you're continually learning.
Yeah, absolutely. Um, you got to stay abreast of everything that's happening, and it's very important that you know that we stay educated so that we can keep up and provide the best care to our patients.
And it's increasingly harder with the newer types of medications, and it's not as straightforward as it used to be 30, 40 years ago. The amount of medications that are available, the types of medications that are available are growing exponentially.
Yeah, absolutely. but we have to stick with evidence-based
Yes,
guideline
I
practice
know that.
and as the medication experts, we have to make sure that what we use in our patients is safe and effective to the best of our knowledge.
Very good. Well, Eddie, thank you so much. I was looking at your record. I've known you since your mom used to bring you in holding your hand and giving you snacks. I'm just so proud that I'm your optometrist, continue to be your optometrist. And I know your family's growing, and I couldn't be prouder of you. I really couldn't. It's been a tremendous joy having you on today's podcast. I thank you very much. I'm sure your advice to our students, our patients, even the parents really helped them a lot. Thank you so much, Eddie.
Yeah, of course. Thank you for having me.
Thank you.